Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Our topic for today is a Chinese medicine approach to acne and rosacea with Dr. Antonia Balfour. Dr. Antonia Balfour has been an acupuncturist and a doctor of traditional Chinese medicine, specializing in dermatology in Pacific Palisades, Los Angeles, California, for more than 20 years. In her practice, Yin Yang Dermatology, she treats many patients suffering from acne and rosacea, often together with hormonal imbalances and digestive disorders, with Chinese herbal medicine. One of the strengths of Chinese herbal medicine is being able to customize herb formulas to meet the unique needs of each person. Dr. Balfour studied traditional Chinese medicine, dermatology, with foremost expert Mazen Al-Kafaji for more than 10 years, and she's a contributing author of Learned Skin's ebook, An Introduction to Chinese Medicine Dermatology. Dr. Balfour, thank you so much for joining us today.
Thanks for having me. I appreciate it.
So how did you become interested in treating patients with dermatological problems?
You know, dermatology is hard in any modality, really. And I would say when I was in acupuncture school, which is back in the 90s, I was an intern at the student clinic at Yosan University here in LA. And at that time, I saw two different patients that had severe skin issues. One of them she was young, maybe 18 or 19, 20. She had very severe eczema, and she would come to the clinic and we would give her acupuncture and herbs. And I remember it was heartbreaking because she suffered so much. I mean, she had severe eczema and she would come in for treatments. I would give her acupuncture, and, we'd put table paper on the acupuncture table. I remember she would get up and there would be spots of wetness all over the table paper because her eczema just oozed all the time, and she didn't leave the house. She was, kind of agoraphobic, and the eczema was so severe that, it caused all kinds of other things. She was just stuck in her life at that time. And I remember as a student, and I was in my 20s, it was heartbreaking for me to see this. And one night, I know after I treated her, it was the only time as a student I cried when I got home. This was like so much to see her. But she did get really good results with Chinese medicine, which was great. And it was super motivating for me. But at the same time, I had another student that I treated who had very severe psoriasis that covered a lot of his body. And he did not get good results with Chinese medicine at the time. And I remember sort of this mantra going through my head: dermatology is hard, dermatology is hard, dermatology is hard. And I was young and I wasn't ready to sort of take it on at that time. It's like, you're enthusiastic and got the ego, you got to heal everybody. And so I didn't study dermatology seriously at that time. I was too scared. But then fast forward a few years, I got deeper into practice. And what happened when I was pregnant with my daughter, I developed a skin condition that's called PUP. It's not that common and everybody hasn't heard of it, but it was incredibly itchy. And from my collarbone down to my knee, I would get these lesions all over, and every night itching. And I did see someone else for Chinese herbs at that time. But really what it did is it made me aware, like, I don't know enough. I was serious about the study of herbs, but I didn't know enough about dermatology. And sort of at that same time, I had studied with a mentor who had retired, and I was kind of seeking out a new mentor, and the stars aligned for me then to discover studying with Mazen Al-Kafaji, who you mentioned. He at that time was only teaching in the UK. So when my daughter was little, I ended up like going back and forth to England to study with Mazen Al-Kafaji, which was great. It really changed the course of my practice so that I really do mostly dermatology in my clinic right now.
I think it's interesting that the Chinese medicine approach has so many different complex ways of analyzing these skin conditions. I remember Woody Allen in one of his comedy routines talking about how there's like, 2,000 different skin conditions and there's only 3 creams. And I think conventional dermatology ends up prescribing, the same thing for everybody with acne, the same thing for everybody with eczema,
Yeah. That's interesting because I think that that's one of the areas where Chinese medicine can shine is when I see patients and they have never heard of Chinese medicine treating acne before they come in. And they say, I've tried everything. They've been on birth control for their acne. They've been on Accutane and they've tried all the topicals from the dermatologist. And really what happens is they become really frustrated or depressed or upset or angry, whatever it is. And in Chinese medicine, when we treat sort of the whole person, you are kind of treating the emotional aspects as well as the physical aspects. There's often an interplay between the two, and often it does stem from frustration about the skin condition, in the first place. So,
right. So how do you diagnose the underlying problems related to skin conditions like acne and rosacea?
Mostly, Chinese medicine does look at the whole person.
Right.
So we do first analyze the skin. So, there are these terms of art, terms in Chinese medicine where I might say you have too much heat in your body. And that's such a general thing, heat can manifest in so many different ways. But in Chinese medicine, we really are zeroing in to look specifically like, really, what does that mean? Redness and inflammation means heat, indicates heat. But if you imagine somebody with acne, for example, maybe the background of their skin has a deep, dark redness to it. Maybe the background of their skin is perfectly, pale or white or, just flesh colored, and there's no redness. And sometimes what you'll see is sort of a mottled redness, so some white and some red. These things in Chinese medicine all indicate heat, but it's heat that's at how deep is the heat? How severe is the heat? And each of those things might indicate different herbs that I'm going to use. So we'll talk about themes, patterns in Chinese medicine, damp and heat form together. And that could create a pimple. If there's a red ring around the pimple, that could indicate there are heat toxins. But damp heat in a pimple might look different than damp heat in rosacea. If there's like a bump and there's fluid in it, and then they scratch the bump, and then watery fluid comes out. That's different damp heat than pus in a pimple, for example. So these different presentations would lead me to choosing different herbs for the skin. So it starts with analyzing the skin, but your question was really about how do you know when digestive things or other things are involved too. So,
right.
We feel the pulse in Chinese medicine, but it's really mostly about questioning somebody and finding out, doing a deep dive into what are they eating, what's in their diet, how is their digestion. If there's, acid reflux, that's going to make me choose different herbs than if they have, loose stools or constipation or constant bloating. One thing we see a lot in rosacea, people often will have digestive problems. It happens in acne too.
Okay. So let's dig into acne. What is acne?
Yes. Acne is a chronic inflammatory skin condition that is very often associated with hormonal shifts in males and females both. We see a lot more adult acne now than we used to years ago. So I think that very much, dietary, what are we eating, and are hormones in the foods that we eat involved? I think so. And
So talk about hormones
yeah.
in the food.
Well, I mean, it's everything from meats that we eat that, the animals have been given hormones to, I mean, even people that have, I think, an organic, clean diet. Oftentimes I'll see people that feel frustrated because they may have grown up eating a certain diet of fast food, and then they develop acne. Then they've tried everything, and they get to a point where they've changed their diet and they start to eat, only organic foods, maybe no meat, maybe only grass-fed beef, or hormone-free poultry. And then that still hasn't cured their acne. So they'll get super frustrated and they'll, see me for the first time and we'll discuss these things. But honestly, I can say, sometimes changing your diet like that, it's not enough to clear the skin and heal the skin, but it's a great start, because I will see better results with those types of patients that have sort of already changed their diet. Then we start them on an herbal protocol than I do when we're sort of starting from square one with beginning to make dietary changes. So I think that these things really do have clinical results that are definitely noticeable.
Do you see certain dietary factors related to acne? Do you recommend specific things related to diet, such as, asking them not to eat certain foods, thinking about sugar, dairy, gluten, etc.?
For me, the main ones are dairy and sugar.
Okay.
That we want to reduce. But I think that partly with diet, I really try to encourage people. Quitting sugar is difficult, and cutting back on sugar, it's difficult. But I think a good starting point is to imagine, what do you want to eat? What are the good things that you're eating? So I try to guide people through getting the rainbow of colors with their fruits and vegetables, and listening to their body's response. Some people even eat great veggies, but then cruciferous vegetables like broccoli and cauliflower cause them bloating. So that, we really want to find what works best for your body. But I think rainbow of colors, plenty of veggies, a good variety, fruit as well, fruit, sugar, I'm fine with. But sort of minimizing processed sugar. The other thing that, again, just to go back to the theme in Chinese medicine of heat, we want to clear heat if they have something that's chronic and inflammatory and causing redness in the skin. So spicy foods I want to avoid.
Okay. So,
go ahead.
Yeah, no, go ahead.
I was just going to say, in LA, a lot of people are heavy on the smoothies and the pressed juice and celery juice and all those things. Chinese medicine loves cooked foods. It's easier on your digestive tract to pre-digest food. So I tend to believe in moderation. If somebody's, fine drinking celery juice and it feels good and it's healthier than other options, that's fine. But in certain circumstances, I do kind of try to push people toward, okay, let's roast your veggies and not have everything raw in the form of green drinks and things like that. Soups are my preference, but I do work with people to figure out what works best for their lifestyle.
So I read your chapter in that Yin Yang dermatology textbook, that Chinese medicine analyzes the lesions in skin conditions like acne, and depending upon the appearance, where the lesions are, etc., you treat them all differently. Maybe you can explain how you treat different versions of acne.
Yeah. So basically, like I said before, damp heat is a common theme in acne. And if somebody has pimples that are big and swollen, that's damp heat. Somebody has very oily skin, that's also damp heat, right? So it's the same pattern in Chinese medicine. But in each of those circumstances, I'm going to choose different herbs because there are different herbs that will help with boil, and there are other herbs that help with a big swollen inflamed lesion. So what I do is I will write up a herbal formula that has anywhere between 12 and let's say 15 or 18 ingredients. And many of the ingredients in the formula are addressed at looking at, what do these pimples and acne look like and where are they located? So there are different herbs that I'm going to use for chest or back acne versus face acne. And if the distribution is sort of all over, then I'm going to choose different herbs. And if it's just sort of on the jawline, we'll see a lot. And then obviously like deep cysts in Chinese medicine, at that point, we'll say the damp heat has congealed into phlegm, which of course has nothing to do with the phlegm that you might have in your nose or your lungs, but it's metaphorical in Chinese medicine. So, if you have a deep, hard cyst, we'll say the herbs that we use, one of them is literally like a thorn. You look at it and you grab some and it'll prick your finger because, but it's breaking up, it's transforming the phlegm, and it's a different pattern than just the damp and the heat. So, so getting specific with the look of the lesion is super important. Yeah.
And it's interesting that you're using 12, 15 different herbs all at one time.
Yeah, that's part, it's interesting. Chinese medicine dermatology dates back to about 200 BCE. So it's over 2,000 years old. And it's the oldest written traditional medical system. So, there are these texts and some of these formulations that were written hundreds and thousands of years ago. And then, people over time will argue and new ideas come about and things evolve and change. But these groupings of herbs, sometimes it's a pair of herbs, sometimes it's 4 herbs or 6 herbs that are in traditional formulas. They have a synergistic effect that we still use these same sort of modules or groups of herbs now that were used hundreds of years ago. And then, we blend them together and we use different things. But when it comes to pairings of herbs or 2, 3, 4 herbs that I'll use to create an effect for acne, that these things have been used together, and there's a power of cooking them together. I make my herbs into teas, and they've done some research about cooking them individually and then having somebody drink them versus cooking them together. There's a different effect. I think it's almost like cooking a curry on your stovetop. It's different when you cook your spices together and then there's that synergy, the flavors that comes together. I think something medicinally happens in a comparable way when you cook herbs together in a tea. And so part of it's going to be analyzing the skin, and then part of it will be looking at the other factors that are involved in somebody's health picture. So, if they do break out before their period every month, then, that balancing sort of the hormonal aspects is going to come into play. And I treat surprisingly relatively few teenagers with acne. I think that teenagers, they want to do what their friends have done, or they'll do proactive, I treat more adults with acne that have sort of been through the Western medicine route. They become frustrated and then they sort of look for the alternative. But it's surprising, even a lot of perimenopausal, menopausal women, still getting acne or getting acne again if they haven't had it for 20 years. They'll get like a lot of jawline acne. And so those herbs and that sort of hormonal imbalanced state are different than what I might use for a 25-year-old who's, getting a period every month and breaking out every month with their period, which is pretty common.
Why is taking antibiotics like tetracycline not a good idea for acne?
Oh, well, for one thing, antibiotics are prescribed for so long for these, well, I was going to say for youngsters with acne, but it could be anybody with acne, right? That they stay on tetracycline for months and months and months. And then what it does to create gut dysbiosis, I think, it's creating a longer term problem.
Right. By messing up your microbiome.
Yeah. Yeah. Totally.
Now, what's wrong with taking medications like Accutane?
Accutane. I mean, when you think about Accutane, anything that makes you sign, I mean, young women on Accutane need to sign something promising they'll use 2 forms of birth control, because if they accidentally get pregnant while on Accutane, they could have severe birth defects with the child. I mean, what it's doing in that scenario, you can only sort of imagine how strong of a medication this is and what effect it could have on the individual that's taking it. But, just I've seen a lot of people who had bad side effects from Accutane. I also people sometimes they'll come to me and they feel like they have to apologize that they took Accutane in their past. And I think, we've all made decisions about our health. And of course, people will make a decision to take something that they know is cautioned against because they're so desperate to get rid of their acne. So there's no sort of judgment about having taken Accutane. But what I do see is because it does dry the sebaceous glands, I think that it does longer term damage too when you're trying to get the elasticity in the skin back at a later time. So I've seen patients that are, young in their 30s that took a lot of Accutane in their teens, and then their skin in their 30s looks a little older than it should because it's really kind of dried out and not done so well. So I don't know. I think it's a little harsh.
Right.
Yeah.
And so do you typically recommend taking these herbs? You make them into a tea, or do they sometimes take capsules? Or I know some people just take the powder. I had a friend of mine, he would take Chinese herbs and he would just pour the powder in his mouth and then pour some water in.
I know I've seen people do that before. And it's so funny because I think maybe I tried to once and I felt like the powder went up my nose and it was like too intense even for me. But, right. I have patients, we make the teas into these vacuum sealed pouches, and I have patients, in high school that take them, like they'll open it up like a Capri Sun and they drink it straight from the plastic pouch, which I couldn't do that either. But no, the traditional way to take teas, and what they do in the dermatology wards in China, at the traditional Chinese medicine hospitals, they have separate wards for different specialties. And the dermatology patients, they take teas because teas are strong and teas are good. So I do that where we have machines that will cook the herbs at a super high temperature and under really high pressure. When it's a pressurized system, then there's no steam escaping. So the volatile oils from the herbs isn't escaping into steam. All the good stuff goes into the tea, which makes it really strong tasting. But and then it's vacuum sealed into a pouch, and it's all BPA free, plastic pouch, but it really keeps everything fresh. And then they drink the tea. So when patients, are traveling, or for some conditions, I'll recommend powders, but the powders aren't as strong. So, depending on the patient and what they're presenting with and how severe their condition is, then typically I do teas.
What is rosacea and why do people get this condition?
It's newly thought in more recent times that rosacea may have an autoimmune component, which people didn't think before. And an autoimmune condition, then your immune cells that should attack pathogens and allergens and things that are trying to invade your body, your immune cells start attacking your own healthy cells. And basically with rosacea, it's typically people in their 30s, 40s, 50s that will start to get rosacea for the first time. It's often seen in sort of Scottish, Irish, Celtic people. So I think there's something about that skin color of the pale skin. But I have certainly had patients, of multi ethnicities that will have rosacea. But, sometimes it feels like the skin is burning. Sometimes it's just that it flushes and gets red. And sometimes it's red all the time. rosacea, again, it's sometimes
How would
people
you
will have.
describe what rosacea looks like for somebody who's just wondering, I wonder if I have rosacea?
Oh, so in early stages of rosacea, you could just flush. You get in this, if you're in the sun, you get pink cheeks, but it'll come and go and come and go. If you have an alcoholic drink, you might get pink cheeks, and then it goes away by itself. So there's that, it comes and goes and comes and goes. And then sometimes you'll wonder, like, do I have acne? Because I went in the sun and suddenly I have these little things that look like pimples on my cheek. They're little pustules. And then, they'll go away. But usually you can see that it's triggered by the sun. And usually if somebody's reached, 30s, 40s, 50s, and they're not getting acne all the time, and this is a new thing, then that's a clue that it's rosacea. Oftentimes you'll see what's called telangiectasia. It's like these little spider veiny looking veins that are distended in around the nose a lot of the time. So, but that could be in the cheeks too. And then with men, sometimes, like my dad has rosacea, and he has like a bulbous nose that, it's kind of got some bumps and things and misshapen, and he's a Scottish guy with rosacea, but yeah.
So I treat a lot of patients for digestive disorders like SIBO, and I often see rosacea, or sometimes they see rosacea as related to SIBO or other gastrointestinal conditions.
Yes. Yeah. We see that a lot. Yeah. When I started practicing, I think 22 years ago, we didn't even hear anybody coming in with SIBO, and now it's a super common diagnosis. I worked for a website when I was still in acupuncture school. And one of the most popular articles I remember at the time was about irritable bowel syndrome.
Right.
And now we know that
SIBO is the main cause of IBS,
the
right?
biggest. Yes. I think it's really interesting to understand, if somebody has hydrogen dominant SIBO or methane dominant SIBO, or I guess hydrogen sulfide is the other one. I think I see hydrogen and methane SIBO more in my practice than hydrogen sulfide. I think maybe you could tell me more about that, but would that be people that have like joint pains and other things that are associated with it a little bit more? I don't know, but for the skin stuff, I see hydrogen and methane.
Yeah, no, hydrogen and methane are definitely more common than hydrogen sulfide for sure.
Right.
And we've only recently been able to test for hydrogen sulfide. So that test has only been available in the last year.
Yeah. Yes, I've learned about that too. The Trio Smart.
Yeah.
So I think that anything that can give us information, I find it to be valuable. So any functional medicine test, because sometimes it just leads you to ask more questions. I might not be giving people sort of a classical SIBO treatment protocol that they might be getting from their naturopath or functional medicine doctor or their GI doctor. But when I know what's going on with them, it helps me understand from a Chinese medicine perspective, like, okay, how is this manifesting? Is it just bloating? Are you getting loose stools? Is it alternating? I'll kind of dig deep into asking people about their bowels. And in Chinese medicine, it is important. People will say, I have diarrhea. Well, what does diarrhea mean? Is it explosive? Is it foul smelling? Is there mucus? Is there blood? Like all these things actually would lead me to choosing different herbs. Or are you just getting like loose stools every day? Or, how many times a day is someone pooping? I mean, all these things are super important clinically, and it gets uncomfortable. And sometimes I feel when I'm with a patient for the first time, it's like, we're getting pretty like down and dirty in that first appointment where I'm getting, I'm not letting them get by with just telling me like my digestive system is off or I have diarrhea. I'm like, okay, let's explore this a little more. Gotta get into the details.
There's no doubt that having detailed questions about people's bowel movements is a personal thing, but that's where a lot of the good stuff from functional medicine comes.
Yeah. Chinese herbs too. That's where the good stuff comes.
And nothing like a good stool test as well. So,
right.
Tell me about some of the herbal approaches to rosacea.
Again, what I'm doing is I'm using a different herb for a different herb combination for somebody who has flushing rosacea versus, bumps or pustules. And it's kind of interesting if somebody does have pustules, that they have pus-filled bumps, those herbs will be different mostly than what I would use for acne. I'm choosing, in both situations, again, I would say that fire toxins might lead to pustules, but which herbs to resolve fire toxins, it's going to be different in rosacea than it would be in acne. But again, it's really treating the whole person and their gut, balancing out the digestion. Yeah. Rosacea, sometimes I'll give people herbal topical creams and things like that. And sometimes I don't. Very often people will have tried a lot of things and they found that.
Are there any common herbal, Chinese herbal topical treatments that people can try on their own or that other functional medicine practitioners can utilize?
Sure. Well, my mentor, Mazen Al-Kafaji, has a line of Chinese herbal topicals. It's called Dermatology M. He's got some great stuff for rosacea. There's a colleague of mine who has a website. It's called Zai Dermatology. So it's Zizai Dermatology. She's got good topicals for rosacea. So their websites for both. Also just hydrosol sometimes, even like a calendula hydrosol that you can get from like mountain rose herbs, things like that can be good.
Maybe for those who don't know what a hydrosol is, can you explain what a hydrosol is?
A hydrosol is sort of a plant water. So when they're making essential oils from the plant, essential oils can be strong and too strong for people's skin a lot of the times. Definitely, at the very least, you want to dilute an essential oil with a carrier oil, like a plain oil, like almond oil or even olive oil, coconut oil. Those are carrier oils that you could put an essential oil into. But when you have rosacea, if you have stinging and burning and redness of your skin, you don't want to use an essential oil at all. So in that process of making essential oils, they also, I think there must be some kind of steam process, but they make waters from the plant that are separated from the oil. So the waters are a lot more mild and they can be tolerated. The shelf life is maybe a year. It might vary from plant to plant, but they don't preserve it like in alcohol or anything like that. So you have patients who have really sensitive skin and they can put very little on their skin to have a plant water essentially that doesn't have anything else. It's gentle, but it has good healing attributes.
Cool. Just give us an example maybe of a couple of hydrosols that sometimes are effective.
Yeah, chamomile is a good one. Sometimes people that have a lot of allergies, if you have a lot of eczema, then that might not be the best choice, but calendula is a good one. Certainly, what else? Rosemary hydrosol can be very calming for the skin. So those are some good choices of hydrosol. Rose water is very well known as something that can calm your skin in rosacea too.
Right.
Yeah. So again, you want to be minimal. You want to start with the minimal thing and start with sort of the least invasive, and then maybe you can work your way up to stronger things. But when your skin's really flaring, you want to go easy and not use a lot of active ingredients. So an essential oil would be.
Do you find there's any food triggers for rosacea?
Spicy foods can be a big food trigger for rosacea. People have SIBO with rosacea a lot, and sometimes people will also have acid reflux. And so in that case, you kind of want to minimize any kind of spicy foods or greasy fried fatty foods, certainly anything like that. And alcohol. Alcohol is a big rosacea trigger.
Okay. Do you ever use non-Chinese herbs in your practice, like probiotics?
Yeah, again, with SIBO, you have to be careful with probiotics. A lot of people
Right.
that have SIBO don't
Sure.
tolerate probiotics
Yep.
well. So it used to be, I think some years ago, I would probably tell everybody to take probiotics because I thought at that time that, the probiotics are good to restore everybody's good gut flora. But again, there's like keeping up with the information that we have about dysbiosis. Now I'm not quite so readily willing to recommend them to everybody.
Right.
But yeah, so getting a SIBO diagnosis when it seems like it might be indicated, it's so valuable. So you can kind of work with people along what they should be eating and what supplements they should be taking. But probiotics are good. Niacinamide is another, it's a vitamin B3 derivative that I
Yep.
think there's been quite recent clinical research that's shown that niacinamide is a good supplement for some people with rosacea. So,
Right.
when you have answers like that are relatively inexpensive and easy to take and well tolerated,
Right.
I always like supporting people with that kind of thing.
Now, when you put somebody on, you do your analysis for
Yeah,
somebody, say with rosacea, and you put them on a
yeah.
herbal formula.
Hmm.
How long do you keep them on that? And do you
Hmm.
change it? Do you alternate
Hmm.
other herbs, or does it depend
Yeah.
on whether the condition changes, its appearance, etc.?
Yeah, there are certain things that don't change quickly, like melasma, for example, or vitiligo, certain skin conditions where you don't see a lot of fast changes. So somebody might be on the same blend for a longer period of time to see how things can shift. But with something like rosacea or with acne as well, changes can happen relatively quickly. And Chinese medicine theory is that there's a journey of healing, and that journey might last 3 months, it might last 4 months, it might last six. Sometimes it's longer than that, usually not for those conditions. But there are different phases of treatment. So at the beginning phase, you're sort of clearing redness, clearing things that are excess, you're clearing heat, you're quelling inflammation in that way. The end of treatment, what you're doing is stabilizing the skin. So you're nourishing the skin, and that prevents future flares and future breakouts. So it helps over the longer term. It's not that I might not see somebody a year later if they have a little flare again, then we can get them back to stability. But this idea, this concept of there being clearing and then nourishing, and in the middle we do a bit of both. So it's called harmonizing. That's the word that we would use. But nourishing the skin with herbs that are tonifying or moistening the skin, healing of the skin barrier. It's a hugely important concept of Chinese medicine. And I think it's one area where it's sort of Chinese medicine is a little superior to Western medicine in that way, and just the idea in that concept, because in Western medicines, like you said with Woody Allen, there are three things you could put on people's skin that's flaring. Well, one of them would certainly be a steroid, right? You could give somebody a steroid cream to subdue any kind of inflammation. Well, the steroid will subdue the inflammation. Sometimes that's all you need, right? The body comes back into balance. It finds its own homeostasis. You put the steroid on and then they're done. But oftentimes that's not the case. And in Chinese medicine, if you're going to clear inflammation, the herbs will not be as strong as the steroid, but you will clear the inflammation. Well, then you nourish the skin, because you need to actually kind of heal the skin in a different way after you've cleared the inflammation. So just from like the concept of that, it's pretty powerful and interesting way to look at skin healing. Chinese medicine.
How do you nourish the skin, and what sorts of are there certain favorite skin treatments are there certain oils or lotions you
Mhm.
like to use for skin, just in general, for skin healthiness?
Definitely. Certainly, with eczema, I like to use sunflower oil because it's very well tolerated, right? So if somebody had active eczema and anything might irritate their skin, coconut oil has been used in many traditions around the world, and in India, in Chinese medicine, coconut oil has withstood the test of time, let's say, but still it's not the right thing for everybody. Somebody could have an allergy to coconut oil, but something like that is well tolerated. Sunflower oil is well tolerated. I like evening primrose oil. It has some essential fatty acids that are really good to nourish the skin, to moisten the skin. And that's kind of one of the ideas of what I'm talking about. You might use sunflower early because it's well tolerated during an inflammatory phase. Then later you might use evening primrose oil to nourish the skin a little bit more. And there are herbs that you take internal that would sort of act the same way. But to your point, if I've worked with somebody with a lot of acne or rosacea, and let's say they need to stop treatment earlier than I might like because of they don't like the taste of the herbs, or it's getting it too expensive and they can't afford it, then nourishing your skin with good botanical oils, it's another way to help keep the skin stable and help kind of lock in the good results that you've seen from treatment. So.
And do you ever do acupuncture for skin conditions?
I don't do a lot of acupuncture for skin conditions. There are certain things. Shingles is so painful.
Yeah.
That's a skin condition where I will do acupuncture just to get people out of pain and misery. Sometimes for eczema, because if they're itching, and the thing about itching a lot is it's maddening. It can drive you crazy. And so in that case, acupuncture can be really helpful. But really, I mean, the other
Chinese herbs that are really effective for itching.
Yes. But again, it depends on, a dry itch versus like if somebody's got like blisters on, if you have hand eczema with a lot of blisters, that's like a more damp itch. So you're going to use different herbs for that than if there's dryness. But yeah. The other thing I would say is that another kind of superpower about Chinese medicine is with herbs and acupuncture both, we're treating sort of the mental health, the emotional aspects of skin conditions, as well as the physical look of the skin. And it does happen very often. I have patients who will come into my clinic and, I've got a big box of tissues and they start crying because, their skin condition is really upsetting. Anything that affects the face and their appearance, it's really upsetting, or anything that causes itching that can be upsetting in a different way. And I get people often and they'll come in and they'll tell me their story and they're very upset and they'll be crying and then they apologize for crying as if, most people with skin conditions aren't upset. And it's just such a truism of treating the skin that you're really treating people's emotions at the same time, because so many people have an emotional component, whether it's the trigger for their skin condition or not. Maybe they're unrelated. They just live side by side with one another. But the fact of having a skin condition can be really emotionally draining for people. And acupuncture can really help when the stress or the anger about the skin condition is just helping to propel it and keep it going or cause future flares. Chinese medicine can act on both parts of calming the emotional aspect and then healing the skin also.
Cool.
Yeah.
So I think that's pretty close to a wrap. Any final thoughts you want to leave our listeners and viewers with?
Just that the only final thought I would say is that, the one unique thing is just that we individualize a formula. So if you come in, and you need treatment for rosacea and your sister has rosacea too, it might be that your formulas are totally different. And I have seen that before, even with twins, where they both come in for the treatment of acne. I remember a set of teenage twins and their two formulas were so different because everything was different about them. So yeah, it's really about getting to the heart of what's going on with your skin and the rest of your constitution.
So don't take your friend's Chinese herbal formula for their skin condition.
I've had that happen too. I had a husband and wife, and she had eczema and he had psoriasis, and he took her eczema formula. He knew he was taking her formula. He was like, I ran out of my herbs, I took hers. Things got worse. I'm like, no.
So it really does matter. Specificity makes a big difference.
It does matter. Yeah.
That's great. And how can folks listening get a hold of you and seek your care?
The best way is through my website, which is yinyangdermatology.com. So it's YINYANG dermatology.com. And then we're also on Instagram and Facebook and everything as Yin Yang Derm.
Great. Thank you, Dr. Balfour.
Thank you. It's great to meet you. Thanks so much for having me.
You got it. Thank you for making it all the way through this episode of the Rational Wellness Podcast. And if you enjoyed this podcast, please go to Apple Podcasts and give us a 5-star ratings and review. That way more people will be able to find this Rational Wellness Podcast when they're searching for health podcasts. And I wanted to let everybody know that I do now have a few openings for new nutritional consultations for patients at my Santa Monica Weitz Sports Chiropractic and Nutrition Clinic. So if you're interested, please call my office, 310-395-3111, and sign up for one of the few remaining slots for a comprehensive nutritional consultation with Dr. Ben Weitz. Thank you, and see you next week.